A common theme that I see being addressed on patient forums as it relates to breast reconstruction is the profile of your implant. I see patients all the time advising other patients, make sure you tell your plastic surgeon to give you a full profile implant or an extra full profile implant. Can you choose your profile, and what does that mean? This is a really important concept. When we choose an implant for implant-based breast reconstruction, we have to fit the base width of the patient. So this is the width of your breast, where we want the implant to eventually live on your body. So we have a base width. The volume or the size of the implant is just going to be dictated by what fits under the skin envelope. So if you have a direct-to-implant, it's whatever fits at the time of the mastectomy. If you have a tissue expander, it's whatever fits once the tissue expander is removed. So we have base width, we have volume, and that gives us a projection. It's not something that we choose. This might make sense if we look at my handy Allergan implant guide. You can tell it's well loved because there's coffee stains on it. Now I use Allergan brand implants, but it's the same theme with any implant. And you can see there's all these different color-coded tables. And what these color-coded tables tell you is for a given base width and a given volume, what the projection would be. Let's do an example. So an average base width is usually somewhere around 14 centimeters. So let's say a person has a 14 centimeter base width and their implant size is 520 cc's. Their profile will be a moderate profile. Now let's say that same person that had a base width of 14 wants to have a ginormous implant. So they really expand the skin with the tissue expander and they want to have a 650 cc implant. So like 200 cc's greater. Since the base width is fixed, the only way to get more volume is through increased projection. So that person would have an extra full implant. Profile is just a subjective term that implant manufacturers give to implants. They could have literally not even used the profile. They could have just had a base width and a volume. And this concept can be very confusing to patients. But remember, base width, volume gives us projection. Now patients will say, well, can't you just use a more projecting implant and a more narrow implant? That would make your breast look like you have a little softball on your chest. You want your breast implant to fill out the whole width of where your breast was because that's going to look most natural. Now you can ask your surgeon what profile they think they will be using, but remember, it's something that's really given to us as opposed to us having flexibility of choosing. This is very different than a primary breast aug. We can discuss that in a different video.